What we do here matters, because what we don't do matters even more.
We need to continue to push, and we at ADAO are going to continue to push the Surgeon General of the United States.
As you know, the United States continues to use asbestos, and that indeed is a barrier to others stopping its use.
The most horrific part of this whole story is that it is preventable.
We're going to begin our program. Before we start, we would really like to thank the volunteers, the speakers, and the sponsors and honorees that make tonight work. As you know, ADAO is a nonprofit organization. We are fueled by your time and dollars. We have one part-time intern, and the rest of us are primarily volunteers. So I think it's important when you look at that table, you see how beautifully they're done. I know Lisa, Ellen, Suzanne, Dominique, Megan, I may have forgotten someone, I apologize if I did a beautiful job taking an academic classroom and turning it into a beautiful dinner for all of us to enjoy. So please thank them. We had 30 speakers from 7 countries come together for a long 8 hours, amen, today. But seriously, where else can you get this kind of information where it's medical, it's patient advocacy, prevention, and global advocacy? We're proud of our program dynamics, and the fact that you come, you share, and you come back next year means the world, because we know it continues. So what we're going to do, we have a few video acceptances. We're going to begin with Representative Capps. We also will be thanking our sponsors at the end, but I want to give another shout out to our speakers, who we don't pay honorariums or travel or hotels, give of their time. Those PowerPoints take hours, and their thought to make this conference fabulous. And I want you to know it's videotaped, so for all of you in the health and safety field, use your video, use previous ones, share them in the workplace and the health field, and raise awareness with us. So, Dr. Lemon, you're being beckoned to the podium. Dr. Lemon serves as the Science Advisory Board co-chair, ADAO volunteer extraordinaire, along with Dr. Frank and Dr. Castleman and others, and you're going to present the first award.
And I've been with you since the beginning.
Huh?
And I've been with you since the beginning.
And he's been with us since the beginning. You're right.
Well, I got a spot on my tie from the gravy. Now I have lipstick on my lips. Does anyone want to tear my shirt, and we'll get ready to go? I have the privilege of recognizing Congressman Capps for her dedication, and she has been a very strong advocate for health in her time in Congress. She's a nurse by training. She has supported health issues extremely advocacy-wise in doing so, and she has been a strong supporter of ADAO. And unfortunately, she can't be here tonight, but we do have a video of her, and I would like to play it, and that will be her acceptance of the award. So if all of you could please, I know she can't hear it, but give a round of applause for Congressman Capps and her dedication.
Hello, and thank you so much for this recognition. While I'm unable to join you in person today, please know that I'm with you in spirit, and I'm deeply honored and humbled to be named the recipient of the 2013 Tribute of Hope Award and to be recognized among the other distinguished honorees. As a public health nurse, being recognized for my work in this field is incredibly gratifying. In all my years in Congress, making our communities healthier and safer has been my primary priority. I'm fortunate to have hardworking partners like all of you here this evening in this fight. You are the ones who are making this vision a reality on the ground. And together, we are all working in our own ways to keep our communities healthy and to spread awareness about asbestos. Thank you. And I must recognize Linda and Doug for your work in this arena. In the 9 years since you founded the Asbestos Disease Awareness Organization, or as you call it, ADAO, your efforts and dedication have been unmatched. And over the years, ADAO has grown, and all of you have created a support network that has improved the lives of countless patients, their caregivers, and loved ones. Your tireless work, conducting innovative research, and courageously sharing your stories and advocating for an end to asbestos use, this has improved the lives of countless families. And you have made strong gains on the national front. We need people like you to hold us lawmakers accountable and to ensure policymakers take the necessary steps to prevent all asbestos exposure everywhere. I truly believe that together and under your lead, we can prevent asbestos-related disease. So thank you for your kind words and leadership, and thanks to everyone here for all that you do day in and day out to better our communities.